This is Carla. Carla is an adult woman who lives with her family in Favelinha, a shantytown community in the urban periphery of Rio de Janeiro, Brazil, where the average family of 4 lives off of the equivalent of $108. That's half of the local minimum wage per person. Carla happens to hear of a sexuality education workshop for adolescents run by a local NGO, and she's curious. In the workshop, a facilitator encourages the participants to explore the differences between biological sex, gender, and sexual orientation. She notices that the safe use of certain words is being normalized, and that everyone seems to feel confident enough to join the conversation and think along. At the end of the session, she approaches the facilitators to express her support for safely and openly talking about sexuality with youth. Carla is in her early 40s and pregnant with her 6th child. She explains that this is going to be her last pregnancy because just the previous week, she learned how to use a condom. She's determined to encourage her children to attend the next workshops so they can have access to this sort of information and so they can be better informed than she was. It's possible that Carla didn't have the opportunity to learn about contraception in her 40-plus years. But it's probable that at some point along her prior pregnancies, she had access to free condoms and information about contraception at her local health clinic. As a Black woman living in poverty, however, she was likely exposed to content that followed the usual narratives of STI and HIV transmission and unplanned pregnancy prevention. And this didn't appeal to her. But what if instead of leading with the risks, Carla would have been approached with more sex-positive messaging? What if pleasure had been acknowledged and named as one of the main motivators for her engaging in consensual sexual activity? What if free condoms would have been offered to her as a way of engaging in more pleasurable sex, leaving risk reduction only as a secondary advantage to condom use? Conversations around SRHR, family planning, and sexuality education can be really empowering if they address the audience's core needs and desires. They don't need to be uncomfortable, and they don't need to involve shame. Effective comprehensive sexuality education is all about addressing human things such as connection, pleasure, and sex in a human way. After all, being human is one thing we all have in common.